Do you think that private healthcare should run alongside the NHS? What in the political corruption and socio-economic injustice are you on about? Private healthcare benefiting the rich, making the rich richer, the poor poorer, strengthening this economic divide that's ever present within society. It's not focusing on the NHS. Ebenezer Scrooge and that. Are you trying to decrease the surplus population? Is that what it is? Are you trying to be like the ignorant Victorian rich? Yeah, you seem to have a captivating take on things. He's so one-sided in his argument, and why is he taking it so personally? Do you think that private healthcare should run alongside the NHS? Okay, so there's a broad variety of different perspectives that we can use to tackle this question. Now, first and foremost, I'm going to start with the arguments in favour of private healthcare. Now, private healthcare, a benefit to it is that it reduces the NHS waiting list, okay? So people that are well off enough to pay for private healthcare, that means they're not going to be on the NHS's waiting list, putting a burden on the NHS's resources. Instead, they'll be on private healthcare. So that means that people that can't afford private healthcare get seen quicker. Okay, that's a benefit. Furthermore, some doctors want to supplement their income with private work. If they don't have the opportunity to do that, then they might leave medicine or leave the country, none of which are ideal. People who pay for private healthcare actually pay twice. They pay their national insurance contribution, some of which goes to the NHS, and they also pay for their health privately on top of that. So a school of thought says that if they're well off enough to do this and they're still contributing to society, then why shouldn't we allow them to have the option to endeavour to do so? If they don't, then they'll just go abroad, and the standard of care might not be the same as it is here. Hence, they might then have to put a burden on the NHS because of a procedure that they've had abroad when they could have just been seen privately. Now, a downside of private healthcare is that it may cause a doctor to become more financially driven and less clinically driven. Okay, so they might be focused on making a commercial relationship with the patient rather than being altruistic and focusing on purely maximising patient health and care. Moving on, some private hospitals end up using NHS resources, like for MRI scans, they sometimes send their patients to an NHS hospital, which ends up using the NHS's resources, and they're being seen privately, so it's a loss-loss. And finally, it only benefits the wealthiest part of the population, so it may increase this economic divide that the Don was talking about in the previous clip.